Perhaps the most rewarding aspect of SoundBite, other than just learning something new and being able to offer something unique to my patients, has been that emotional response that patients have. I had a patient, young guy, he came in congenitally deaf in one ear. He's never had hearing in his left ear. So this man comes in because he heard about SoundBite and he thought, well, wouldn't that be interesting? Could I hear from that side? But he was not obsessed with it. He was pretty well adjusted to life with just one ear. And as soon as we activated the device, all of that changed. And I could see the expression on his face. His wife came up to him and said, "I love you," and whispered it in his ear. And all of a sudden, we went from this kind of laid-back moment of, let's see how this goes, to this really, let's grab a Kleenex moment, where everyone, including myself, were quite moved by what had just happened, what had just transpired. So we had a patient who was not really looking for much of anything, he was just totally blown away by how much he could hear from that side, and I think how much he had been missing. Patients with single-sided hearing loss are in many ways unique, with one ear being perfect. That loss for some patients is congenital. They've had it all of their lives and they're fairly well adjusted to living with one good ear and one ear that doesn't hear. A lot of those patients lost their hearing suddenly. How it impacts their lives, they feel that they should be able to function well enough because one ear is functioning usually perfectly, but they can't. They find a layer of isolation coming from their one ear that doesn't hear that they're not sure how to overcome. They have to position themselves strategically in meetings, in restaurants, in group settings, and patients feel isolated from their environment and from their loved ones because of it. Patients with conductive hearing losses, on the other hand, they actually often have used hearing aids. With draining ears, with chronic middle ear problems, very often those patients fail. So hearing aids have been a very frustrating experience for those conductive hearing loss patients. We have patients who have full coverage that it would be a zero cost to them to pursue, for example, a bone-anchored hearing aid or a BAHA, and yet they choose not to. So cost is not the issue. The issue has been they do not want a surgical solution because they know a lot of these folks are very young. They know how technology moves very quickly, and they know that in 3 or 5 years there'll be something better, whether it's SoundBite version 2 or 3 or the next newest and latest thing. The non-surgical option up to this point had been cross hearing aids, routing of the signal from one side of the head to the other side of the head. But it's still air-conducted sound. As small as the device can be in the patient's ear, non-occluding, leaving the ear canal open, the quality of sound between bone-conducted sound and air-conducted sound, it's an amazing quality difference that is so hard to quantify. Once you experience the difference of what bone-conducted sound sounds like versus air-conducted sound, I think that question is answered. Bone-conducted sound is far superior to air-conducted sound, no matter how well we shape the sound. The most important thing for me, other than the technology and the fact that it's non-surgical, has been, okay, how does it work? How do patients hear using this device? And I don't mean hear in my office in a quiet environment from their bad side where they can't hear, but how are they going to do in a noisy restaurant? How are they going to do in a conference room with someone whispering with other, maybe music or other noises in the background? And I think that's where SoundBite has by far exceeded my expectations. The trick is the placement of the microphone in the patient's ear canal, capturing the pinna effect. A lot of those single-sided deafness patients have been told there's nothing that you can do, or BAHA is your only option. So I don't know if necessarily the sound was what was amazing them, or the fact that they could hear from that side that they've never heard from, or is it really the fact that, oh my God, I can actually get this done and hear like this without this surgery.